or a month ago, October 18th, in the United States, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association declared a state of national emergency for youth mental health. So the trends since we started, that's really the trend line looking back 10 years. Depression, anxiety, suicidality, suicide attempts, and suicide, drug use have all been going up in kids. The COVID pandemic made it go like that, like a hockey stick up. And this data just came out. So it's very serious. Now I read, Yasmina gave me some reports about Denmark. And for 10 years, it's also been going up. But I haven't seen, that was 2010 to 2018 for 8 years, what I read. It didn't have very much about this year, but maybe not as steeply as in the United States. So there will never be enough therapists and psychiatrists to meet the need. Like, the need is like this, and the number of therapists and licensed professionals is like that. And especially if they're going to be in government buildings that have stigma all over. You don't even want to park there unless you're paying a traffic ticket or picking up your friend after going to court. So one thing this report said is they needed new solutions, innovation and action to improve access to quality of care, community-based. And that's the important piece. Community-based and person-centered. So a little more on the numbers in California. Only 5% of kids on the public health system receive behavioral health care. Only 35% of kids who say they want care receive care. So 65% of kids need help and don't get it. Most of the kids in our jails have behavioral health issues, 70%. And strangely, California, which is the 8th largest economy on the planet Earth, in the United States is ranked 33rd in mental health care for kids. Like the prevalence of mental illness and the access to care. So that's pretty embarrassing if you hang out in San Francisco, right, like I do, except I live in the mountains. So it's a strange situation. Part of the problem is the way the system is set up for professionals, for medical professionals, to treat the issues that kids are having, is it's very disempowering. And I know that your work at this center, talking to Paul, there's a lot of emphasis on what youth need. And I did hear that they would, in the hallway, that there's also a need to hear from youth more youth voice. And that would be good, that maybe the next conference have young people here to speak. So kids want autonomy. They want to make their own decisions. They do not want adults telling them what to do. And this framework of being able to offer treatment within that context is really helpful. They want to feel in control. And yeah, the kids who are struggling, the kids in trouble, the kids with emotional disturbance or mental illness symptoms, a lot of them have had this for a long time, and they're having so many experiences of adults saying, like, you need to change, you're a bad kid, you're expelled from school, you're having time out, you're, all these things, or more serious. One more thing about our system that I think is really important. In California, there's a big emphasis on the science of adverse childhood experiences. So the kids that we are working with, 95% of them have clear histories that when you learn about their history, it makes sense how they're acting today. They're having a rational response to a horrible history, right? If you really look at it that way. It might be difficult to deal with. It might be very disruptive in school. It might be scary and violent, but some of the abuse and trauma that kids have in very low-income households or households where there's drug abuse or alcohol abuse or sexual abuse or all these things, it's extreme trauma. And if they're 10 years old and acting out, it's very easy to understand that. So the path of treating them has to be a partnership. You can't just be like imposing it. And that, unfortunately, their experience is, being medicated and having treatment imposed. So our program, Whole Hearts, Minds, and Bodies, we started 10 years ago. It is 7 licensed therapists supervising 26 well-trained, well-paid paraprofessional therapeutic mentors who each treat 2 or 3 youth. That's it. We drive alone in our car to the school bell rings, pick the kid up, go outside 2 to 3 hours. We drive to the trailhead, we're in the forest. If it's pouring rain or a snowstorm, we just go to a cafe, we might journal. We spend the time with them. We feed them and bring them home, to their house, and do it again next week. And it's simple, but it's kind of revolutionary in our system. Most people in America are extremely paranoid to be alone with a child. And we're alone with an emotionally disturbed child. But it helps that we have the risk management of mountain guiding, taking, heart surgeons ice climbing. We can take children in a car to a trail. The method has had a lot of success in a number of ways. And I'll start by just talking about our retention rate. Because half of our youth are youth of color, or Latinx youth or Hispanic youth coming from Mexico or South America. And youth of color, research shows, are 50% less likely to engage in therapy. If they might do it once and never go back, than white people. Although adolescents are not that impressive in engaging in therapy. In America, for the public health system, for Medicaid, the average engagement with therapy is 1.4 visits. That's it on the national level. 1.4 is not enough. So we peaked in September with 62 kids getting treated like this every week. 91% are still doing weekly sessions after 6 months, and 69 to 71% after a year. So they stay with it. They love the program. They stay with it. They get, 6 to 18 months of weekly engagement. And let me back up a minute. These kids are the highest need kids. So today we have a wait list of 26 kids. We're doing that hockey stick thing in our community. We have like 52 kids. We had some successful graduations this fall. 52 kids today, 26 wait list. The school psychologists and the hospital and the counties do not refer a kid who just has depression or anxiety. They have to be debilitated by symptoms, self-harming, violent, disruptive, kicked out of school, in jail. Many people call us and we don't put them on our wait list. We send them somewhere else. Sadly, there aren't a lot of other options. But yeah, so these kids are very serious cases, and our retention rate is really good.